So we all know stress is a normal part of our daily life, but is stress bad? No. And at certain moments in our life, it can help us and make us, stay on track. But however, if we let stress overtake our normal functioning, it can become bad. So if we say that it takes more than 6 months, you might need to start finding somebody to help you with your anxiety. So research shows that anxiety in 34% of students can have moderate to severe anxiety. So there are anticipatory anxiety. So if you're worried about anything, events in the future, you can have test anxiety. So that actually can be even with anticipatory, like you're anticipating the test, you're anticipating, the grade that you're going to get on the test. And then even in college students, you have social anxiety. So you have social anxiety from just your classmates and even outside of the class. All right, so some signs and symptoms. So if you're nervous, uneased, you can have sleep disturbances, which can lead to insomnia. We can have depression, anything that just overtakes your emotional daily life and function. So what do we need to avoid? We need to avoid trying to hold in our anxiety. We need to stay away from drugs and alcohol. We need to make sure that we keep our family and friends close. And most importantly, we need to make sure that we stay physically active. All right, so some questions that you can ask yourself are, for a college student, is the class what is causing the anxiety? Or is time management causing your problems? So, but the good thing is, as we all know, that anxiety in a college student can be treatable.
My name is Ashton Trapani. I'm a student physical therapist assistant. Today I'm going to be talking to you about some of the benefits that exercise can have for students. First one is reducing stress and anxiety. When we exercise, our brain releases endorphins, which is a chemical that is responsible for making us feel relaxed and happy. It also decreases the presence of hormones that cause us to become stressed or have anxiety. If you exercise as little as 5 minutes, it can reduce your anxiety as well. If you have test anxiety, taking a walk before you go into your exam can help alleviate your anxiety. The next benefit of exercise is it helps improve your quality of sleep. 30 minutes of aerobic exercise can improve your quality of sleep and prevent you from waking up as much in the middle of the night. Aerobic exercise also decreases the amount of time it takes you to fall asleep at night. Exercise can also improve your academic performance. When you exercise, it increases the size of your hippocampus in your brain, which is responsible for our learning and memory recall. It also increases the amount of blood circulation that goes to our brain, which gives us more oxygen. And the more oxygen our brain receives, the better off we are when it comes to learning in our classes and retaining the information.
Another benefit of exercise for college students is that it boosts your immune system. Exercise can help prevent sickness and make for better grades and less chance of getting sick and missing class. So if you find yourself missing class a lot and not exercising as much, then maybe a little bit of exercise can help you with that. Research shows that moderate intensity exercise increases circulation of the immune cells in your body to help detect those infections early and maybe even fight them off. Exercise raises your body temperature. So this may help prevent bacterial growth, and it kind of works like a fever. So when you're infected in a fever and you get hot, it kind of works the same way. Also, it boosts your immune system by helping you sleep better. Some research points to higher risk of infection and development of cardiovascular and metabolic disorders, and a reduction in antibodies of the production of inflammation cytokines in people with just a short amount of sleep. Another benefit of exercise is preventing weight gain. Weight gain is very popular, freshmen 15, and college students. So getting up and having a normal exercise routine can help you fight off those extra pounds gained. So benefits of exercise can last after college as well. Research shows that a habit takes about 66 days of voluntary action in order to produce that habit. So once you produce that habit, it becomes a part of your everyday life. So if you start exercising in college and make it a daily thing for about 66 days and you get into that habit, it no longer becomes a chore, just part of everyday life. It'll help improve your quality of life and keep healthier choices later in your work environment. Increase your quality of life, reduce risk of heart disease and diabetes and other medical conditions.
Did you know that the CDC recommends 150 minutes of moderate to vigorous aerobic activity per week with an additional 2 days of strength training? So that's 30 minutes, 5 days a week, plus 2 additional days of strength training. Are you meeting those goals or are you falling a little short? I know the challenges of trying to fit in exercise while you're in college. It's really easy to say you're gonna do it at the end of the day, at the end of class, or maybe you're gonna start next Monday. But I want you to know that consistent physical activity is associated with improved fitness, reduced anxiety and depression, and improved sleep and quality of life. Even a single episode of physical activity can provide a temporary improvement in cognitive function and decrease anxiety. So what does aerobic and muscle strengthening exercise look like? And what does moderate to vigorous mean? Running, brisk walking, bicycling, basketball or soccer, dancing and swimming are all great examples of cardio activities. Pretty much anything that gets your heart to beat faster and increases the respiration rate. But what we're really going for is working at a percentage of your max heart rate. And calculating your max heart rate is super easy. Subtract your age from 220 to find your maximum heart rate, then multiply that number by 60% for moderate activity and 80% for vigorous activity. And that will be your target heart rate range. Muscle strengthening exercises make your muscles do more work than they're accustomed to. That is, they overload the muscles. Strength training includes lifting weights, working with resistance bands, and doing body weight exercises such as push-ups, pull-ups, and planks. When strength training, base your effort off of a 10-point scale, where moderate is 6 out of 10, and vigorous is 8 out of 10. While not part of the CDC recommendations, flexibility is also an essential part of physical fitness. Flexibility activities enhance the ability of your joint to move through the full range of motion, which allows you to do exercises and activities more efficiently and without pain. For those reasons, flexibility activities are an appropriate part of physical activity. And remember, time spent doing flexibility exercises do not count towards your 30 minutes of aerobic activity or muscle strengthening exercises. So next time you're on campus, check out the Lone Star College Wellness Center. They have all the equipment you need for your cardio, strength, and flexibility goals. Thank you for watching our Wise and Well video. I hope it gave you some ideas on how physical activity can help lessen the anxiety in your college life.